Welcome to another episode of the HealthCast. I'm super excited today to have Dr. Cassie from the Children's Therapy Network in Ventura, California. Welcome, Dr. Cassie.
Thank you. Thank you. I'm happy to be here.
Okay. You are the founder and owner of Children's Therapy Network.
Correct?
And you guys, some things that I learned about it, you guys do physical therapy, occupational therapy, speech therapy. Is it both in-house and in the patient's or client's home? Or is it?
We do it all. So it is in the clinic. That's the majority of the clients that we have right now, but not because we can't go other places. That just seems to be what the need is. But we have gone into the family's home, and we've also gone onto the school campuses, and we do virtual therapy. So we're everywhere.
Very cool. Tell me how'd you get to this point in your life? How'd you become an owner and physical therapist? And what was your journey like?
Yeah, so it's funny, I actually have a teenage daughter right now, and I've been asking her, like, what do you want to do? You're going to be graduating soon, and she does not have a clue. As so many teenagers, that's not uncommon. But I knew at a very early age that I wanted to be in the medical space, and I knew I wanted to work with kids. Like, I just knew. I remember I was in elementary school and I'm like, I'm going to be a pediatrician. Both my parents were in the healthcare industry. And I remember I was starting to go through school. I was doing pre-med, and both my parents were talking about kind of just the changes that were going on in healthcare, and is pediatrician what I really would want? This is what it would look like. And my mom actually was the one that was like, you might like physical therapy. You're always active. You are, this is the way you tend to think in these terms. And you can still work with kids. And so I volunteered, shadowed a physical therapist, and I loved it. I loved the relationship that the therapist had with the patient. I loved that they got to spend more time. I loved the diversity of what physical therapy could do. And so I did shift gears. Good thing all that prerequisite stuff was kind of the same, so I didn't waste any time. And so like I said, I went into physical therapy, and I always knew I wanted to work with kids. So um, jumped into being a pediatric therapist, obviously after you do all of your other rotations. And, I had quite a bit of experience with adult and neuro and wound care. If I wasn't a pediatric therapist, I would have gone into wound care, but that's a whole nother topic.
Funny wound care stories too.
Anyways, so that's how I started my career, how I started my business. I had somebody tell me one time, "You're an accidental entrepreneur." And I was like, "What does that mean?" And they explained it to me, and I was like, "Yep, that's me." I've always been I've always been entrepreneurial minded. I've just always naturally thought of what's a better way to do this, or what's a different way to do this. It's just the way my brain has always worked. But I didn't set off initially to start a business. I started picking up private clients working in group homes where I was their consultant. And at one point in my career, I had to seriously stop and go, I'm going to kill myself here between my regular job and my private clients that I was building. And I remember very specifically sitting at my kitchen table with a, pen and paper, and wrote out how much could I make if I maximized my private clients right now. And when I realized I could cover my costs, I'd be poor and I'd be eating top ramen for probably the next year. And I did, but it was so like, oh, I could do this. And so I took a leap of faith and I quit my job and I went out, struck out on my own. And I swear, somebody put my name like on the bathroom wall, need a good physical therapist, call Cassie, because I kept getting busier and busier and busier. And at some point I was like, I need help. So I asked a friend of mine, hey, could you help me? And we got busier and busier and busier. So I asked one of my patients' moms, hey, could you do the billing and the paperwork for me? And at one point, by the way, looking back, I realized, wow, I did everything wrong, carrying my my stuff around in my little box in my trunk of my car. Anyways, but at some point I had, a couple of employees that I was paying, and I thought, "Oh my god, I think I have a business here. I better learn how to run it." And it just kept growing from there. And because my mind already had that's the part I love about entrepreneurial. I love being I love being the dreamer, the visionary. I love being the one that's like, what's the next awesome thing that we can do? I don't like the bookkeeping and the operations part. I'm going to just tell you that right now. And that's why I hire people who are really good at that. I've
That's
got one
understandable.
lady who's like, well, let's do the math. Can you send me a spreadsheet? And I was like, God bless it. You and your spreadsheets. She loves it. Like she geeks out over it. And I'm like, thank God it's you because that is not me.
Right, right. We all have our skills.
We all have our skills. She's funny because she's also like, "Well, don't ask me to think outside the box. I'm not the visionary. Give me a spreadsheet any day." And I'm like, "All right, cool."
And that you guys launched in 2004, and here we are,
Yes.
almost 2026.
Yep.
Pretty very cool. Take me through what how about a day to an average day to day for you? If there's such a thing, what's that look like?
The day in the life of Dr. Cassie. You know,
Like, do you still see patients and
I do. I do mostly the evaluations. I found that at this stage, and I discovered this probably, I don't know, I guess it's been 6 or 7 years that I don't hold a regular caseload anymore. I do still do the evaluations, and I do love doing that. I love the evaluations, but I found that it was not fair to my patients for me to carry a regular caseload because my mind was always on what was going on in the business or what was going on with some employee or something. And I didn't feel good about what I was doing as far as a therapist was concerned because I didn't feel like I could give them my undivided attention.
I understand.
Now the evaluations, I'm able to unplug that, that owner mind for that 1 hour or that, hour and a half that I'm doing an evaluation. That I feel I can give them my undivided attention and then I can go back to being the business owner. But when I had a regular caseload, I wasn't being fair to the clients. So no, I do not carry a regular caseload anymore. What I do more of now, and I have spent a good part of the last, 5 to 7 years really building up a team, a system where it is not all dependent on me.
Mhm.
And that has and still is, I'm gonna be honest with you, a hard identity shift. Kind of the same as what I was just talking about. It was a really hard identity shift for me to shift from I am physical therapist Cassie who has a business to no, I am the business owner. And so to shift that identity to realize that I have to think more like a business owner and less like a therapist anymore. And so now I'm at a new mental shift, whereas I am the business owner, I am the owner, I am not the operator. And so the last couple of years, I've been building up a team to do the things that I am not good at. Like I said, spreadsheets. I can do them. I can look at them. I know how to work them. I don't love it. I don't love it. So a day in the life for me is amazing actually because I am at the point now that I could choose not to work. The place would run without me,
Sure.
and
True.
that's awesome.
That's pretty cool.
But I actually really love it so
Yeah.
much that I just can't help myself. In fact, sometimes my team is like, "Could you get out of my hair? Like, we got this. We're good." So anyways, yeah, so a lot of the times I'm in meetings with my leadership team. We're launching a new program, so it's funny that you're gonna talk about AI because we are launching a new program, with a new therapy tool that is very AI driven.
Okay.
And that's been a big project of mine that over the course of the last year, we've been experimenting, rolling it out. What are the systems? What are the operations? And so tomorrow, actually, literally tomorrow is our last training with my
Mhm.
staff before we full launch. So
Very
I'm
cool.
excited about that.
Very cool. Can you highlight some we'll start with the maybe some uncomfortable stuff and then some wins. Can you talk about some challenges over the years that you've had to work through? And then I was
Oh,
also maybe some success stories that you're really proud of. Those 2 parts.
sure. The number one biggest challenge, I think, in all healthcare is the reimbursement. Our healthcare system is broken. It's broken. That would be the number one challenge is we do not get reimbursed enough to actually afford the services that these kids need. And because
Huh.
we're working
Mm.
in pediatrics, as opposed to say, well, let's even just take adults, physical therapy, right? With adults orthopedics. Let's go with orthopedics, PT. Those people are coming in usually for short term, 6 to 8 weeks. They come in for an ACL tear or whatever. They come in for a few weeks. They're rehabbed. They come in, the other thing is adults. You can see, several adults together in the gym. There can be two, three, sometimes four people that you're overseeing at one time. And they're there for, let's even just spread it out for 3 months. They're there for 3 months. Pediatrics is not like that. These kids are coming in usually, not all of them, but usually they're coming in because they have some sort of congenital, lifelong disability, Down syndrome, cerebral palsy, autism. These are kids that are going to need some form of intervention at some point in their life for most of their life,
Is that
right?
the majority of your clientele versus, say, a kid with a broken knee or, ACL, broken shoulder, something?
Yeah, the majority of our kids are the ones that I just described. Um, and they're very one-on-one. It's not come in and there's four of you, oh, go do your exercises over here and I'll come back to you. No, it's very singularly focused. And so the number one challenge is the reimbursement.
Yeah, I can, I am compassionate to that. I feel for that. My wife runs a, formerly primary care clinic, but insurance was just a drag. Now it's evolved to the cash-based only business. She would receive checks after seeing patients for an hour that were worth less than the stamp.
Yes.
Like, she's received checks for 25 cents mailed to her
Yeah. Yeah.
for
Yeah.
seeing a patient for 45 to 60 minutes or something.
Yeah.
So
Yeah.
I understand what you're saying. I'm sure it's the same in the physical therapy world. I understand.
It is. And we are compassionate. Healthcare people in general are like teachers. We're compassionate people. And so we do it because it's a passion, but we got bills to pay too, right? We want to live a good life. And most of the therapists are physical therapy is a doctorate degree now.
Yes.
And OT and speech is moving in that direction too. And so here we have people that have doctorate degrees who are coming out of school with, student debt, student loans, whatever, and they want to make a decent wage. There are, yeah, the reimbursement doesn't even cover their payroll, let alone any operational fees.
Yeah,
So
it's a concern. Yeah. How about some successes over the years? Maybe a story or two that you're particularly proud of?
I've been in here for 21 years, so I've survived it. It is not just a story of survival, which that in amongst itself is I'm particularly proud of and I think is a success story because we have survived this really tough industry and we have survived fires and floods and earthquakes and pandemics and go ahead. It's like the apocalypse here, but we have survived it. But here's something that I am when I look back at the years of service
Mhm.
and I go back and I look at our electronic medical system and know that not me single handedly, but my company has helped well over 10,000 families in this area.
Yeah.
And we check in with families, a couple like once a year or maybe once every other year. We'll call them up and just be like, "Hey, just checking in with you. Do you need anything from us?" And, from a business perspective, of course, I'm looking for them to go, "Oh, yeah, can we come back to therapy services? Sure." But from a heart, when they're like, "No, we're good.
Yeah.
He's doing great in school," or they're going to be graduating from high school soon. Like from the heart and the soul, I love hearing that. And that makes me proud. So I feel
Um,
like I'm making the world just a little bit better.
I would agree. What resonates, what I hear is that I think you had a calling to this and the sincerity of the work that you do. So it
Yeah.
comes across and as you share your experiences.
Thank you.
Tell us how you're incorporating AI into your work life and how is it impacting patients?
Yeah, so it's funny when ChatGPT came out, what, 1 year, 2 years ago, something like that, when it was
Mm.
like I mean, I know AI has been around for a while, but when ChatGPT was released, I kept telling my staff, "You've got to use this. You've got to use this," and this is and nobody wanted to use it. They were like, "No way, man." Like, I don't know, like they thought the cyborgs were coming to get them or something, right?
Right.
And I said, "Listen, so here's how I started, and here's how I told my team." So I just started playing with it, and I told them, "Just play with it." So I remember one night when I was first introduced to I was putting my little boy down to bed, and I was reading him a story. And I said, "We're gonna try something different. We're gonna write our own story." And so I had him tell me what he want who the what the character was, what the, I mean, I walked him through like, okay, what's the character? What's the problem? Because you can't have a story if you don't have a challenge. What happened? What did he do to solve the problem and what was the outcome? And so my son, I think at the time I guess he was like 8. Yeah, he would have been 7 or 8 at the time.
Mhm.
And he was like, I want to have it as a penguin who lost his iPad, of course, right? And he has to search the world for it. And, anyways, so we write this story, and ChatGPT created this whole bedtime story. And that was the story that I read to him for his bedtime story. So that's kind of how we started. And that's what I was talking to my team about, like, help it write your emails, help it draft, your proposals. You want to come to me with a proposal for a problem? You got a problem? Come to me with a solution, and have AI start helping you. Because when you come to me and go, oh, there's, toilet paper keeps running out, right? I just made that up, but whatever. I don't come and complain to me. Tell me what you want me to do about it. And so that's kind of how we started. And now my team is like, ChatGPT is, I think we should make ChatGPT the employee of the quarter, or employee of the year, right? They all use it. My therapists, I tell them to use a HIPAA compliant. We have a HIPAA compliant Gemini through Google.
Yes, ma'am.
I said, help it write your notes. But what we are implementing right now, it has not fully launched yet. Two things. One that I think is going to make my therapists happy and make them more productive, which makes me happy, but I'm not really excited. It doesn't like my flame on fire. And that's an AI scribe so that they can, actually in our EMR system, our electronic medical system, that they can just open the mic and it'll AI scribe their
Mm.
notes. So
Yeah.
that's in the process right now. So we haven't actually launched that, but I'm really excited about that one.
Yeah.
But like,
We've adopted that one in where I work. I work in primary care. In
yeah.
the last 6 to 8 months, most of us have adopted that. People were doing it individually, then the company picked something up, the hospital
And
picked
how do
something
you
up.
like it?
I was probably the last one to jump on board with it, I think just being intimidated, and now it does save me time, and yeah, I think I have more attention. I just put my phone down and on a desk and have a conversation, and, most of my note is built for me, and it's not just like a voice recording to text, it makes it, relevant to the situation. Like someone comes in, say, for a cough, and I happen to know that, and I'm like, "How was your dog? How was that? How was your Thanksgiving?" or something.
That's about right.
It just documents to the situation, and so it's pretty slick. And I've gotten I
I've
like it.
been testing it out with my evaluations, and same thing. I just record. I just turn the mic on. I record. I'm able to take pictures of like the kid's posture or their feet or how they're going up the stairs or down the slide. And the AI actually, the you always have to check it.
Yes.
But one of the things that I've noticed that I'll look at the AI, and as long it makes me feel good because I'm like, that's what I saw too. You know,
Yeah. Right.
thanks for verifying that I actually do know what I'm doing. But that's been helpful. But my passion project, and write this down because you are going to want to interview these people. So there are two platforms. So do you know have you ever heard of remote therapy monitoring?
I've heard of remote patient monitoring. I imagine it's similar.
Very similar. Very similar. So remote patient monitoring is more for the medical side, heart rate, respiration, those kinds of things. Remote therapy monitoring is the home exercise programs. That's more
Yeah.
for rehab, right?
Yeah.
How are they rehabilitating? It's not remote therapy monitoring is or remote patient monitoring is not new, but it is fairly new. It's really new to pediatrics. And so these two platforms that we're using so you want to look at Coro, write this down, KORRO.ai. The other one is Augment Therapy. Those are the two platforms that we have chosen. Now, those are not the only ones out there. But what these systems do is they've been designed and developed by therapists for therapists, but they put it into a game. So we set the family up to play these video games. Do you remember the old, well, I guess it's not old, they still exist. You know the Nintendo Wii?
For sure. Yeah.
Okay. So it's kind of like that.
Yeah.
where the kids are dancing or they're bowling or they're flying through, space or whatever it is. They're collecting coins, while they're surfing on a rocket ship or whatever. But the camera on the mobile device or on the computer the whole time is measuring joint angles, how high they can raise their arm, how long they could stand on one leg. Um and it then takes that, it analyzes that, it sends a report to the therapist who then can look at it and go, okay, well, I noticed that you can't stand on your right leg as long as the left leg. So let's practice this exercise more often. And so it's a home exercise program, but we can send it home with the families. The kids can do it on their own, on their iPad or whatever device they have. And the whole time, all of that data is being sent to the therapist, and the therapist can reach out to the families through the app and say, Johnny's doing great. Let's keep doing this. Or don't forget to do your exercises, as opposed to just sending people home, and go, okay, I want you to do 10 leg lifts every day for, 3 times a day. And then, your patient comes back and you go, did you do your homework? And they lie totally to your face and go, yo, yeah, sure, no problem. I did it every day. And dang well, no, you didn't. You big fat liar. Or maybe you get the patient that's totally honest with you and was like, nope, didn't have the time, didn't do anything. And so, but what I love about this is that the AI is not only analyzing and sending these reports to the therapist, but the AI is also suggesting new exercises. So even if the therapist, let's say they weren't able to log into the system for a day or two, the AI is going to go, okay, we noticed that you're not standing on your left leg longer than your right leg. And so we want you to work on, the rocket ship surfing exercise. And when we first started this, I was experimenting. So I was playing the games and I wanted to see what report did it come up for me. And I was shocked that it saw. So I have an old shoulder injury from like in my 20s, right? I don't even notice that there's a problem anymore, but the AI was like, looks like you had a left shoulder injury because you're not raising your left arm as high as you do your right arm. Because I wasn't like I was trying to fake an injury or anything. I was really playing the games. I was like, I'm a patient and I'm doing this. And for it to come up with that, I was like, that's amazing. That's one of the AI systems that we are implementing, and that's the one that I'm most excited about and the one that's most fun. The AI scribe is practical, and that'll be good too, but it's
Yeah.
not as fun.
And I understand the AI scribe part. That seems pretty straightforward. But the other one, you're going to start implementing them with patients and patient care.
Yes.
Yeah, that's cool.
Yeah, we actually have already started a few pilot patients, and so far the testimonies that we've gotten from them have been excellent. Like the families are saying the kids want to come home and instead, the kids grab their iPads and they're doing these exercises and they're improving. We had one mom say, um, it was so cute. She said, yeah, my daughter said that she's growing new bones in her hands because she's been able to improve her handwriting.
Improve
So,
dexterity and stuff from her gains.
yes, and it's all because she's doing these things on the games. And so yeah, so the kids like it, the parents see the progress, and so it's been really good.
That's great. That's cool. How does the future look for Children's Therapy Network?
The future's so bright. I got to wear shades.
Did
I couldn't help it.
I mean, I imagine that market is, I wouldn't say, I'm not sure if unlimited is the right word, but I imagine it's just keeps growing and the need keeps growing, I imagine.
The future for CTN is the need is there. Here's the challenge is that there are more kids than that need therapy. So that's a good problem to have as far as a business is really concerned. The problem is that less and less therapists are coming out of school. And so that gap between the availability of therapists is getting smaller. And the other thing that makes it even more compounded as a problem is that more and more healthcare workers want to work remotely and less families want remote therapy. So that's actually part of the reason that I created that class that I was telling you about for virtual therapy because we got to bridge that gap. We've got to bridge that gap. So The future for Children's Therapy Network, we will be here. We are expanding though into more of the digital platforms, and we've been doing virtual therapy for the last 10 years. So it's not like it's something new. It's not like it's something that suddenly we're like, "Oh, COVID made us do it." No, we've been doing it for years, but I'm seeing a gap and I've got to address that gap. And that's not necessarily because, oh, telehealth is now a fad. No, there's a gap and it needs to be addressed. I see Children's Therapy Network being stable and I see it expanding and I see that AI and virtual services are going to be a big part of that.
That sounds fantastic. Just as you hear in the news and a shortage of healthcare providers, whether it's nurses or docs or like myself in between, I'm not sure people are saying, but I think you may have touched upon the shortage of physical therapists. Is that right?
Yeah, shortage of physical, occupational speech. I think, like a lot of healthcare industry during COVID and right after COVID, about 20% of the workforce in our industry just left the workforce, or they left the profession. Not just that they left the workforce, they left the profession.
Despite now, and as a community, we still have growing needs as a larger community.
Right. Actually, we have more kids needing therapy than we did pre-COVID.
Shed some light on that for me.
Well, we're getting all those COVID babies now, right? That missed school or, didn't have the socialization or,
That's what I
so
thought you. Yeah, that makes sense.
well, and we're also diagnosing better now. So,
Thank you so much for coming on and spending some time with us. Where can people go to learn more about Children's Therapy Network?
well, obviously check out our website. It's children'stherapynetwork.net. Make sure because there is another children's therapy network in New York. Call us, come by. I would also say our social media pages, so Facebook, YouTube, all of those things, I'm constantly putting out educational resources for families, even if they're not mine. Like to me, I'm like, let me get the information out there for families, whether they're a client of ours or not. So check out our Facebook and our YouTube channel. I think a lot of families will find some really good resources there.
That's cool. Thank you so much, Dr. Cassie, for coming on with me. I appreciate it. I know you're a busy lady.
Thanks, Phil.
Take care. Thanks for tuning in. Stay tuned for the next episode.